Okay, caller 1 wins courtside seats to tonight's game.
What? I won floor seats?
You did.
I've been calling for 13 months.
Wait, Chris?
Yes, I finally did it.
What are you gonna wear?
Men's Warehouse. They've got today's looks for any occasion, and I need to look like a celebrity.
Don't want to stick out.
Exactly. They've got Chill Flex by Kenneth Cole, Joseph Abood, and a tailor at every store for the perfect fit.
Congrats. You can stop calling now.
Not a chance.
Get any look for every occasion at Men's Warehouse. Love the way you look.
LifeLock, how can I help?
The IRS said I filed my return,
but I haven't.
1 in 4 tax-paying Americans has paid the price of identity fraud.
What do I do?
My refund, though.
I'm freaking out.
Don't worry, I can fix this.
LifeLock fixes identity theft guaranteed and gets your money back with up to $3 million in coverage.
I'm so relieved.
No problem. I'll be with you every step of the way.
1 in 4 was a fraud-paying American. Not anymore. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
Hey everyone, Chris here from MedPrep2Go, and welcome to our USMLE Step 2 Questions podcast. I'll be your reader for today, and in this episode, we'll be going over 3 infectious disease questions from our online Qbank, which, of course, you can read all of these questions and more at medprep2go.com. And with that being said, let's get started with question 1, infectious disease number 7. A 34-year-old man presents to the clinic with a persistent cough lasting for 4 weeks, occasional hemoptysis, night sweats, and unintentional weight loss of 10 pounds over the past month. He has no significant past medical history and is not on any medications. He smokes 10 cigarettes per day and drinks 3 to 4 beers per week. He recently returned from a trip to Southeast Asia. Vital signs are within normal limits except for a low-grade fever. On physical examination, he appears thin, and auscultation of the lungs reveals crackles in both upper lung fields. A chest X-ray reveals cavitary lesions in the upper lobes of the lungs. Which of the following is the most likely diagnosis? Is it A, active tuberculosis disease, B, acute bronchitis, C, community-acquired pneumonia, D, latent tuberculosis infection, or E, lung cancer? And the correct answer is A, active tuberculosis disease. Active tuberculosis, TB, occurs when the bacteria multiply and cause symptoms. Common symptoms include a persistent cough lasting more than 3 weeks, hemoptysis, night sweats, weight loss, and fever. The patient's symptoms and chest X-ray findings are consistent with active TB disease, especially considering his recent travel to a region where TB is endemic. Answer choice B, acute bronchitis, is incorrect. Acute bronchitis typically presents with a cough and sometimes fever, but it does not usually cause hemoptysis, night sweats, or significant weight loss, nor does it show cavitary lesions on chest X-ray. Answer choice C, community-acquired pneumonia, is incorrect. Community-acquired pneumonia can cause cough and fever, but it typically presents with more acute symptoms and does not usually cause night sweats or significant weight loss, nor does it typically show cavitary lesions on chest X-ray. Answer choice D, latent tuberculosis infection, is incorrect. Latent tuberculosis infection, LTBI, occurs when the bacteria are present in the body but inactive, causing no symptoms. This patient has symptoms indicative of active disease. Answer choice E, lung cancer, is incorrect. While lung cancer can present with cough, hemoptysis, and weight loss, the presence of night sweats in the recent travel history make active TB more likely. Key learning point. Latent TB infection, LTBI, occurs when the bacteria are present in the body but inactive, thus causing no symptoms. Active TB disease occurs when the bacteria multiply and cause symptoms. Common symptoms include a persistent cough lasting more than 3 weeks, hemoptysis, coughing up blood, night sweats, weight loss, and fever. Question 2, infectious disease 8. A 38-year-old man presents to the emergency department with a 2-week history of progressive shortness of breath, non-productive cough, and fever. He has a history of human immunodeficiency virus and reports not taking his antiretroviral therapy for the past 4 months. His last CD4 count was 180. His medical history is otherwise unremarkable and he does not take any medications. Vital signs are temperature of 99.9 degrees Fahrenheit, 37.7 degrees Celsius, pulse 108 beats per minute, respirations 23 per minute, and oxygen saturation of 94% on room air. On physical examination, he is tachypneic and has diffuse crackles on lung auscultation. A chest x-ray reveals bilateral interstitial infiltrates. Which of the following is the most likely causative organism? Is it A. Aspergillus fumigatus, B. Cytomegalovirus, C. Mycobacterium tuberculosis, D. Pneumocystis jirovecii, or E. Streptococcus pneumoniae? And the correct answer is D. Pneumocystis jirovecii. HIV-positive patients with CD4 counts less than 200 are susceptible to Pneumocystis jirovecii pneumonia, PCP. This organism typically causes bilateral interstitial lung infiltrates and can be seen with silver stain of a bronchoalveolar lavage. This patient's symptoms, CD4 count, and chest x-ray findings are consistent with PCP. Answer choice A, Aspergillus fumigatus, is incorrect. Aspergillus typically causes invasive pulmonary aspergillosis in neutropenic patients and presents with cavitary lesions rather than interstitial infiltrates. Answer choice B, cytomegalovirus, is incorrect. Cytomegalovirus can cause pneumonia in immunocompromised patients, but it is less common than PCP in patients with low CD4 counts and typically presents with more diffuse symptoms. Answer choice C, Mycobacterium tuberculosis, is incorrect. Mycobacterium tuberculosis can cause pulmonary symptoms in patients with HIV infection, but it typically presents with upper lobe cavitary lesions rather than interstitial infiltrates. Answer choice E, Streptococcus pneumoniae, is incorrect. Streptococcus pneumoniae typically causes lobar pneumonia with consolidation rather than interstitial infiltrates. Key learning point. HIV-positive patients with CD4 counts less than 200 are susceptible to Pneumocystis jirovecii pneumonia, PCP. This organism typically causes bilateral interstitial lung infiltrates and can be seen with silver stain of bronchoalveolar lavage.
Raise the rudders! Raise the sails! Raise the sails!
Captain, an unidentified ship is approaching. Over.
Roger. Wait, is that an enterprise sales solution?
Reach sales professionals, not professional sailors. With LinkedIn ads, you can target the right people by industry, job title, and more. Start converting your B2B audience today. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started today at linkedin.com/campaign. Terms and conditions apply.
This episode is brought to you by Redfin. You're listening to a podcast, which means you're probably multitasking. Maybe even scrolling home listings on Redfin, saving homes without expecting to get them. But Redfin isn't just built for endless browsing. It's built to help you find and own a home. With agents who close twice as many deals, when you find the one, you've got a real shot at getting it. Get started at redfin.com. Own the dream.
Question 3, Infectious Disease 9. A 32-year-old woman presents to the clinic with a 3-day history of fever, headache, chills, and malaise. She also reports nausea and episodes of vomiting. She returned from a trip to sub-Saharan Africa 5 days ago, where she did not take malaria prophylaxis. Her travel included time spent in rural areas with significant mosquito exposure. Her past medical history is unremarkable and she is not on any medications. She denies alcohol or tobacco use but mentions occasional recreational marijuana use. Her temperature is 102.2 degrees Fahrenheit, 39 degrees Celsius, blood pressure of 132/71, heart rate of 110 beats per minute, and respirations of 18 per minute. On physical examination, she has scleral icterus and tachycardia. Laboratory results reveal anemia, thrombocytopenia, and elevated bilirubin. A peripheral blood smear shows ring forms within erythrocytes. Which of the following is the most appropriate initial treatment? Is it A, artemether lumefantrine, B. Doxycycline, C. Methloquine, D. Primaquine, or E. Quinine and clindamycin? And the correct answer is A. Artemether lumefantrine. Artemether lumefantrine is the first-line treatment for uncomplicated malaria caused by Plasmodium falciparum in most endemic regions. This patient's symptoms, history, and blood smear findings strongly suggest falciparum malaria. Answer choice B, doxycycline, is incorrect. Doxycycline is not a first-line agent for malaria treatment, but can be used in combination with quinine in specific cases. Answer choice C, methloquine, is incorrect. Methloquine is primarily used for malaria prophylaxis, and its side effects make it less favorable for treatment. Answer choice D, primaquine, is incorrect. Primaquine is used for radical cure of P. vivax and P. ovale, but is not useful for P. falciparum. Answer choice E, quinine and clindamycin, is incorrect. While quinine is used for severe malaria, artemisinin-based therapy is preferred for uncomplicated cases. Key learning point. Artemisinin-based combination therapy is the preferred treatment for uncomplicated Plasmodium falciparum malaria regardless of chloroquine sensitivity. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read our other Step 2 questions at medprep2go.com. Happy studying! Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai and her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com.